Thanks for that, Katie. So you know a lot of us are still working from home. I'm broadcasting right now from my house. But in just a matter of weeks, our educators are heading back into the classroom, into school buildings with students. It is such a nerve-wracking time for so many people, as Florida is considered the epicenter of this pandemic. We've heard your complaints and concerns. The dilemma of whether or not you should go back to work and the angst you're feeling is very similar to what some healthcare workers faced a few months ago. You're worried about bringing the virus home after possibly being exposed at school. Well, healthcare providers, including Dr. David Kayer, the disaster medical officer for UF Health Jacksonville, takes decontamination very seriously.
When I get home, I'm actually undressing in the garage, and those clothes go directly into the washer. I go directly to the shower and try and shower off before I go into the house. Um, as far as general population goes, those measures might be a little bit more strict than the general population needs to take.
Kayer works in the emergency department and is exposed to COVID patients at the hospital. He says teachers don't need to take such stringent measures, and neither do parents with their kids. So what can you do to be cautious when returning home from school?
There is a pretty significant community transmission that's going on right now, so there is a little bit higher risk. As far as decontamination, I think the general wash cycle and trying to take good hand washing precautions, those kind of things are adequate for folks that are out in the community right now.
I spoke with a few nurses who tell me they wipe down their cell phones, water bottles, even work bags, whatever they take in with them to the hospitals. Now, for a complete list, a recommendation by the CDC of what you should be doing inside the classrooms, you could simply visit cdc.gov. The big takeaways, folks: sanitizing, wearing a face mask, and physical distancing measures are critical.